Give you a few minutes to people to come in. Welcome, welcome.
Kind of random. I hope everybody's staying hydrated because this Texas sun is beating me up.
Mm.
Let me tell
Oh,
y'all.
Yeah, we already had a few to pass out at FIFA down here in Houston, so
Oh wow.
Wow.
I already know that
Listen,
heat, no joke.
they dropping like flies. It's hot out there today, man.
yeah.
Wow.
Listen, the wife and I went to an R&B concert on Saturday. When I tell you there was about the medics were working in overtime. I said, "Are we at like a festival?" It was an R&B concert. How are people passing out? When I tell you it was three medics and they didn't stop chasing, picking up people, taking people back. And me and her was just sitting there like, what are they? None of this music calls for any amount of drinking. And we like, man, they all having heat strokes, must be. So yeah.
Well, alcohol and a few other things, you know what it is, and then they're having a
Uh,
good time. So,
Hmm.
yeah.
all right.
Yes, sir. Yes, sir.
So it's about 8:32, so just to respect everyone's time, we'll get started. And as some people come in, we'll just kind of let everyone join and hopefully they'll have a good time. So welcome, welcome to our June Dimensions of Nursing June event. Happy to have you guys, and this is something that we plan to do on a regular basis. So stay tuned. If you like this event, there'll be much more others. Um, just wanted to briefly talk about Dimensions of Nursing because this is something that we really want to take off. This is something that was birthed at a couple of conferences ago when we had such a robust response to a panel discussion. So from this, we wanted to continue the momentum and keep up the passion for men's health. So this is why we are form dimensions of nursing, and with the primary goal in mind is to empower men of color in nursing, because we want the purpose of this is to create a supportive and inclusive environment that encourages men in nursing to pursue excellence in their professional careers. We also want to increase diversity in nursing. I can say this is probably the most nurses, male nurses I've seen at one time in one place. It's very rare,
Yes.
especially male nurses, especially those that may have the doctorate or PhD. It's very rare. So one of the purposes is to encourage those that want to get terminal degrees to push forward. So advocate, and we want to be an advocate because our presence, no matter whether we want to or not, our presence inspires nurses. I'm in academia, and I always get at least one or two students, and every time I teach a class, they say I inspire them just from my presence. So knowing that, I have to be intentional with inspiration. So that's why. And we want to be a representative of men of color in underserved communities. We plan to do a multifaceted approach to dealing with disparities that men of color face in nursing and how it impacts the communities. Usually, many organizations just have one approach. We want to have multiple approaches and provide support at all levels when it comes to developing initiatives for men of color and recognize disparities and challenges that they may face. So this event particularly is, as you know, we're talking about mental health and stigma and addressing that silent crisis among mental health care professionals. The purpose of this webinar is to create a safe and meaningful space for discussion about mental health challenges affecting men and healthcare professionals, to reduce stigma and encourage help seeking, peer support, and open dialogue. So just want to go over some housekeeping items. We will allow for questioning at the end of the session, but if you do have questions and you want to leave in the chat, feel free to leave in the chat so that way we can make sure we don't miss your question. Okay. Generally, the objective is just to talk about the silent burden of mental health struggles among men. We're going to talk about unique pressures faced by minority men and healthcare professionals and how stigma, culture, and professional expectations can delay help seeking. So at this time, I'll turn it over to our moderator supreme, DJ Kirk.
How you doing today? Thank you everyone for joining us. Before we dive deep into it, I really want to just set the stage, right? Because today we are going to um, talk about mental health, and frankly, for some, that's not something that we do open, especially for us as males. So, I got a ground rule. This is a safe space. We're going to talk openly about mental health, including not limited to anxiety, depression, and possibly suicide. So, it's going to be heavy, and if you feel like you need to step away, there's no shame in stepping back and or reaching out. Mental health is here, it's full, it's on display, and this dimensions in nursing exists to break that silence that cost us, way too much. So today we name it, we talk about it, and we're going to move it forward. And I have three people with me today who's going to just blow the lid off of this, right? We got Dr. Maury, clinical mental health expert, Air Force veteran, Dr. Monterey, DNP, psychiatric provider, and Eric Taylor, men's health advocate. And I'm so excited to be on this panel with them sharing it. And so we're gonna dive into it. I want to talk about the stigma because oftentimes as males, we don't talk about mental health. I don't know about you, gentlemen, but when I was growing up, my dad told me, you don't cry, you don't show weakness, you don't show anything. I don't know, Eric, if that's what you've witnessed, or Dr. Murray, if that's what you've witnessed, but that was what was told to me. And to this day, I try to hold it all inside, and I don't express it. Eric, talk to me about it.
Yeah, good evening, everyone, and thank the Dimensions of in Nursing for the opportunity to be here today. But yeah, at that point, man, it's I think that's our basic software. Most men, we come here factory loaded with that, and we just the way the world operates. You cannot show weakness. We don't show vulnerability, and we often suffer in silence with a lot of things that we deal with on a daily basis in the role of being a man in this world. So yes, my father was a very stoic gentleman, and it still is. And he is always shown me how to move as a man, and has always been. You don't really show that, you just tough it, take it on the chin, and you keep it moving.
Hmm.
And you be there for everyone else, and a lot of times there's nobody there for you. So that is very true.
You, that's interesting because, like you said, a lot of times there's no one there for you, and I loved you. Like you said, we're kind of programmed that way. We have the pleasure of having Dr. Murray, who has served in the military, and it's a culture of toughness, right? You're tough, you're strong, and I don't want to put words in your mouth, but Dr. Murray, what have you seen being in the military? By the way, thank you for your service, but talk to us about what have you seen?
Yeah, what's up, fellas? It's good to be here today, and thanks for everybody for joining us live. We suffer in silence, man. In the military, we are shown to be tough, but I try to get men to see that we are human beings. We have emotions just like a woman has emotions. But we're unfortunately, I feel like it goes back to slavery, and I hate to go back that far. Men were
Mhm.
taught that you had to be silent. If whatever the white man wanted to do to you, you had to be silent. You had to hush your mouth. You had to listen up, or he was going to hurt your family. And that guy built all that stuff up in him. And I think it passed down to generations. And we're taught you don't cry in front of anybody because it shows our vulnerability side. And what I try to get the men to see in the world today, it's okay to show your emotions. You are a human being. Never let nobody make you feel less than that. And that's why we're dealing with a lot of mental health issues in the military now because the guys are silent because of what they've been taught.
And it's unfortunate that like you said, we're taught to think like that. And like you said, you were in the service and you've experienced it. Dr. Monterey, you know, in your practice, right? You're well known for treating mental health. What are you seeing? What are some of the stigmas that you face that you see your patients when you talk to them? What are they saying? Dr. Monterey?
Hold on, sorry, I was muted.
Yeah, okay.
Hi,
Yeah.
everyone.
So,
I'm thrilled and honored to be here, and I'm joined by great panelists too. What I'm seeing right now in my practice, right, a lot of male patients coming in, like they tend to tough it out and are afraid to come out that they're struggling. They could be newer dads or somebody that is transitioning into becoming a new dad. It's Father's Day right now. And I know
hmm.
there's like maternal depression, but there's also what I'm seeing right now is increasing rate of like paternal depression. So they're trying to provide, show up, tough it out, and smiling, providing, and they pretend that every day is okay, but inside they're kind of dying in silence. So those depression, anxiety that we're feeling as men, we need to make sure that we normalize talking about it now, and we kind of like, and I'm telling my patients, it's okay not to be okay, and it's okay to talk about it. And gone were the days wherein we always practice the machismo side, right? We need to make sure that we are aware of our feelings and are dealing with it, and we are normalizing it and discussing it openly.
Doing some research for this panel, right? And I came across 63% of men admitted hiding that they've received mental health treatment. Um, what do you guys think about that, right? Versus 34% of women that are hiding that they're receiving mental health treatment. What do you guys think about that?
I think personally they feel it's how society, like Eric said earlier, it's how society makes everything look. If you look at things, men are built strong, men are out there fighting for their families, men are out there doing what they got to do to survive. And I think as a provider sitting on the other side of the table, when I'm looking at that patient, I let my patients know we all have struggles, no matter who you
Hmm.
are, from the poorest to the richest. And a lot of time when I make
I
that
love it.
to them, I tell them, I was like, I've had issues before. I've gone to therapy. And they're like, wow, man, I'm not the only one suffering with this. I think we need to be more real with patients and let them know that this is life and you're going to have some struggles. It may be something you struggle with. I may be strong in that area, but it may be vice versa. You may be strong in an area that I'm weak in, and it's okay if you have to cry. I think a lot of time for men, even when it comes to crying, I worked with a psychologist one time and she said, you know what, crying is cleansing. And I try to remind
Hmm.
patients, it's okay to cry. There's nothing wrong with crying. It's cleansing.
I love the fact that you said crying is cleansing, right? Because now as an adult male, I'll cry. I have no problem crying. I have no problem getting it out. It's better out than in. And, unfortunately, once again, it started as a child where I remember my dad saying, you know what? Be tough, no crying, right? And unfortunately, that's led to me, not wanting to seek help and get help. And I think that that's something that, as males, as patients, we have to encourage, and especially as provider. Eric, when we were, prepping for the show, you talked about how you enter the room to kind of, break the stigma. Like you go in a room and you're not dressing up as a provider. You show that you're them. Talk to me about that.
Well, what I've found in the many years I've been doing is that white lab coat is going to bring fear.
Mm,
Affects blood pressure and a few other things. So I started wearing, like a black scrub top, and I wouldn't even have the stethoscope around my neck. I would come in just casual and just try to break the ice because men don't have safe spaces to go to. And when they come to the doctor, they're scared about what they're going to be told, and they don't know how to advocate for themselves. And a lot of times they don't know what to ask. So I try to make sure to make them comfortable and let them know that, hey, I'm a man just like you. I'm in this world just like you, got the same challenges. But again, still the way that we operate in this world, we don't know how to articulate that in a way where we're not judged. Think about it. Men culturally, men are supposed to provide, protect, and almost be quiet. Work till you die, pay bills till you die. And nobody really cares about your emotions. You don't get your
hmm.
flowers until you're dead. So when you think about all of that, men just move through life because we know if I don't do these things,
Yep.
people are going to notice it. And when a man doesn't do what he's supposed to do, that's when it gets noticed. But while we're doing this, a lot of times nobody asks how we're doing while we're doing this. And we're, again, suffering in silence, but we're getting the job done. And we just don't have places to where we can talk. When you go, just go to brunch, pick a brunch, Sunday brunch. Listen to women talk. Man, it'll have your
Hmm.
ears burning. But listen to the dudes that might be nearby or at the table. They're not saying too much of nothing. They feeding that hole in their face. And they're talking about everything but their psychological or mental well-being. But women, oh, everything. They talking about everything about their clothes, get them emotions flowing, and they're gonna be talking about you. But we don't have a place to do that. And we got to make it safe and normal for men to be vulnerable in those environments and make that part of our routine screening when they show up. Don't just ask about their physical health. Don't just listen to their lungs, check their blood pressure, and all the other things we look at. How
Yeah.
are you doing mentally? And I make it a point. Every patient that I see, yes, I'm taking care of their physical health, but how is your mental health? And I really need you to
How,
tell me that.
But how do you bring that up, right? Because there's plenty of times when I've gone to the provider, they don't assess that mental health, right? How do you bring that up? What are you looking for? What's the intro is needed to have that conversation?
Incorporated into my normal screening. So as I'm asking my history and physical, I mean the history, getting the collecting the information, I'm asking little things. How are you sleeping? You know, how's everything on the job? How's everything with your spouse? Different things like that. And there's certain response they're going to give me that's going to let me know that we need to take a deeper dive in this. And as we work through the physical piece of this and all the age appropriate screenings, at the end, I want to make sure, hey, how is your mental health? And I say we're in some challenging times. The political environment, religion. I mean, there's so many things happening in this world, and it's moving at a very fast pace. How are you processing all of that? Do you have a safe circle of friends that you can talk to and be transparent and be vulnerable and not be judged by those men? And if they don't really answer that like I need them to, along with the PHQ-9 and all that stuff we check, because a
Mm-hmm.
lot of times men are not honest on that as well. That's why you really have to probe. And when I can get them to realize that I'm really there for them and I really want the best for them, man, I have men open up, and I've had so many men cry in the office. It's refreshing for me to know that I'm being able to have that impact with them because they feel that comfortable with me. Because I'm not judging them. I'm here to help. And again, I always try to tie my personal experience into it as well, because again, I'm a provider that has similar struggles. I'm not immune to any of life like they're experiencing. So I try to make it personal and be my authentic self while also being their provider. And it has worked.
I love it. I love, and as you said, right, you're showing that you're human. I love the fact that you're coming in with a black top. Every provider does things differently, but I love your approach to it. Dr. Monterey, what are you seeing? Is mental health showing up differently in older generation versus a younger generation? And how is, technology affecting people wanting to get help or not get help?
Thank you for the wonderful questions. Well, based from my practice right now, I'm seeing that the newer generations now are more vocal about it, especially the Gen Zs. They're more able to talk about it. The older generations are still kind of on the guarded side, but I make sure that I create a therapeutic alliance with them, making sure that they have this emotional safety. If they feel that they are safe to talk about it to you, they will tell you their struggles. But when there's therapeutic rapture means they don't trust you, then it's difficult. It's difficult to dive deeper and be your and what they're struggling with. And this can also be a barrier when you're the provider that the patient doesn't trust you. So you really need to make sure you make them feel comfortable in the first encounter and make them feel welcome. And I usually make an open-ended statement like, "How can I best help you today?" Right? How can you make service for you that makes you feel heard, seen, and valued in the clinic, and making sure that those messages are impactful for the patient, they're able to and you're able to address their needs. And I think that's the most important ones. And now social media came into wherein a lot of people are more like open about it and they talk about it in their different social media platforms too. So I think that there's like good side and bad side of it too.
I appreciate it. I appreciate it. With 1 in 10 men experience either depression or anxiety, yet still not receiving treatment. Dr. Murray, what's your thoughts on that? With 1 in 10 men experiencing depression or anxiety, how are you using your experience being in the service? Because I know you work with a lot of veterans. So how are you leveraging your experience being in the service and talking to those veterans about depression and anxiety?
I think it comes back to like what the brother said about trust, understanding, and making sure they feel comfortable. So one of my statements I say to patients when they come in the office is, you're in an uncomfortable zone now. Because when these brothers are holding all this stuff in, that's their comfort zone. It may be hurting like hell on the inside for them, but hey, I don't need to tell you about the struggles I'm having with my wife. I don't need to tell you about the struggles that I had when I was little and I saw my dad beat my mom up. I'm holding that on the inside. So a lot of times I tell them, I say, you're in a safe place, but I know this is uncomfortable, but I'm hoping that this space that you're in with me, you're going to become comfortable. And I think patients have gut feelings. They know who care. And once they know you care, they'll start releasing things. And I tell them this is a non-judgmental zone. And I have to clear my mind for that when I go in every day. I see patients coming from all
Mm-hmm.
walks of life. straight guys, gay guys, transgender, people coming white, black, blue, brown, all of that. And I have to make sure that I don't have any biases. So that part right there, I have to keep my mind clear and like, hey, even if I didn't come from this background, I need to understand where this person is coming from. And I let them know that, like, hey, I didn't know that. I'm sorry to hear that, bro. Let's talk about it a little bit more. And then once I get their trust, they'll open up the book. But they gotta trust you. If a man don't trust you, he's not gonna open up.
I agree, and you know the whole premise of it, right? We tend to suffer in silence, and unfortunately, you know, a lot of us don't know that there are resources that we can tap into, so that way we're not suffering in silence. But I want to talk about some of the barriers to care, right? Because it starts with that, right? We don't even know that we have depression, and we don't even know that we have anxiety. So, Dr. Morante, what are some of the barriers that you're seeing in your clinical practice, whether it is cultural, financial? What are some of the barriers you're seeing to people actually getting care for their mental health?
Thank you for that wonderful question. I think it's one of the reason, could aside from cultural factors, is the accessibility to care. Some patients are still looking for mental health providers right now with a lot of waiting game. And what 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 is that? Is that they are either their decision is to seek help when they're actually already shrinking at the bottom of the rock ship, right? So we need to make sure we recognize the early symptoms and we tell them that it's okay to seek help as early as that one so that we can intervene appropriately. Because what happens is when they're already suffering and they have severe depression, then that's where in crisis interventions are implemented. And we don't want to go there. We wanted to make sure that they have support and they have different resources that they can use. There's 988 and there's also different organizations that talk about like National Alliance for Mental Health, and which is very um, active organization that helps men also struggling. And at the same time, ethnicity, cultural background, or even family expectations. So there's like compounding factors to that may arise that we need to assess as a provider and address those needs.
You know, I want to dive a little deeper to what you said because you said family expectations, and for some of us, it's job, right? We have jobs that we hold that some of us may feel that if we go get mental health treatment, it may impact our job, right? So, you know, and one of the things I know that I've heard about is examples like pilots, right? They a lot of them, what I've heard, right, is um a lot of them may not seek treatment because it may impact their job. So, you know, for males that are concerned that the treatment that they seek is going to impact their job or it may harm them, Dr. Murray, what do you say to that? Especially once again, being a veteran and serving. Is it frowned upon if you hold certain jobs? Are you seeing that? What is your thoughts, Dr. Murray?
Yeah, you have to think about that. I try to get patients to see, I'm not here to hurt you. I'm not here to harm you. I'm here to help you. And so I think a lot of times, a lot of guys are fearful. Yes, it depends on what type of job they're serving. And I must say, I'll give the military credit now. They are showing more sensitivity when it comes to mental health now because we're losing a lot of soldiers to suicide.
Mm.
So they are trying to be open, like, hey, if you need to be on something for depression, hey, go get help. If you need to be on something for this anxiety, brother, go get help. And what I try to tell patients, we don't have to just jump straight to meds. We can do talk therapy. Let's see if that's good for you. And if therapy is good enough for you, hey, we can just keep that. I want you to keep the therapy going. And then sometimes the fellows will come back and say, hey, doc, I'm doing the therapy, but I'm still getting that anxiety because sometimes when you're in therapy, we're pulling. I tell them, I said, they're going to go clean out the closet. Therapists clean out the closet. They going way back in that closet where you'd have had things for years and you never talked about. Now they're going to pull it out. And sometimes that brings up more anxiety. That causes the depression to become worse. And if I say, hey, if we need something to get you over that hump, hey, let's do that. But it doesn't mean like you have to stay on this medicine for the rest of your life. And I think about if I notice if I explain it to them and I break it down, what this medicine is for or why you need therapy, they're like, okay, I get it. I'll try it. And I always tell them, it's up to you. So I'll use a lot of motivational interviewing. It's up to you. I'm here for support. You let me know which way you want to go. I look at it like this. I'm the tourist and you're the guide. So I'm following your lead. And hey, I may ask a couple of questions to reel you in or to bring you back to a safe space so we can get a little bit more deep into that discussion.
You said a safe space, and I think that's important. Whether it's your home, whether you're actually seeing a provider, it's important that whenever you're discussing your mental health, it remains a safe space. And I want to remind everybody on the call, this is a safe space. And if you feel like you need any help, right, you can dial 988 for crisis intervention. If you feel like you're at risk for anything mental health, you can dial that number. Now, Eric, I want to ask you a specific question, right? Because I want to go back to your approach of wearing that black attire when you walk into that room, right? In 2024, there were already 48,000 suicide deaths in the US alone, all right? That's 13.7 per 100,000 people. And that's according to the CDC data that's published. How do you create that safe space? Now, you talked about, you're really walking in and you're becoming one of them, but what does that look like? And how are you identifying someone that is, maybe have suicidal tendencies, right? Because I'm sure it's more than just changing the shirt and walking in. What are you looking for from a vulnerability perspective, or what are you watching for that they may or may not be saying?
See, when I go get the patient, a lot of times, sometimes they're not always room. I go out to the lobby and get them, and I'm watching
I
their
love
body
it.
language.
I
I'm
love
I'm
it.
looking at how they're interacting with the environment, and I'm watching how they walk back to the room. And as we walk back to the room, I'm breaking the ice. It's casual conversation, and I'm just trying to let them know, this is real down to earth. Yes, you're here for medical reasons, but we just gonna have a conversation. And I like what Dr. Murray said. I'm the guy, I'm the tourist, you're the guide. So you're going to kind of
Mhm.
guide this. But I sit down, I make it very personal and to them as far as getting on their level. And I'm in tune to them, because a lot of times we get in the office, we get back in that room, and we are taking care of that computer, the laptop, and we're not even looking at the
Mm,
patient. And so
yes.
I've, with technology today and all the different, AI add-ons that you can use today, you can record a lot of this stuff and not even have to touch that laptop, and you can fine tune that later. But I really try to focus the bulk of the time in that visit, me and that patient making eye contact. And then again, I'm reading their body language because their body, they say a lot of things. There are a lot of things they don't say out of their mouth, their body language does. And then you just
Mhm.
kind of pick up on those things and you're like, okay, hey, I noticed you seem a little tense, is there anything, what's going on? And then I pry a little more, as Dr. Murray said, we try to clean out some of those things that they have suppressed. And a lot of men feel like that if I'm here for my blood pressure, why are we talking about my mental health? And they don't want to talk
Mm,
about it, but you have to tie it in to let them know how all of this plays a role. And once you can get them to see that, again, I'm here to help, and then again, I will also find a way to tie my personal, experience into that, and let them know that hey, I've experienced that as well, and then they can open up. And once we get that conversation going, man, the visit most of the times it goes over, and they look forward to coming back, and it's like peeling back the layers of an onion. It's going to take a little bit of time to really get to the crux of the matter. But if you are consistent and you do this every time, man, I'm telling you, by after a couple of visits, when they come in, they hit the door, they're going to just start spilling. And I'm pretty sure Dr. Morante has experienced that as well with the way he operates. When they hit the door, hey, doc, I want to tell you this real quick before I forget it. And you forget what they're there for because you start talking about that. So, but that's just my approach, and it has worked over time. And until it stops working, I'm gonna continue with it.
Eh, Dr. Morate, were you gonna say something before I interject?
I just want to agree with all of what my peers are stating that we need to, normalize help seeking and use strength-based language for our patients. And screening in primary care and community settings is very important. And in my practice, I offer telehealth and flexible hours, which makes, I think,
Wow.
more accessible to men. Like they want a safe space and in their manscape probably to talk about it and vent about it. So
So let's turn the lens on ourselves because you do a lot. I've done some research. You do quite a bit, right? Not only do you serve, the patients as we think about them, but you're teaching the next generation of clinicians, right? You're helping them become a provider who specializes in mental health. So I want to turn the lens on us as healthcare providers because oftentimes as healthcare providers, whether you're NP, nurse, CNA, doctor, you you're overwhelmed, you're overloaded, you're burnt out, and we don't know how to detect those things. So, as a provider, how are you treating us as male healthcare providers? How are you checking our compass, checking us for fatigue, helping us treat burnout, and hopefully preventing it from moving to anxiety, depression, or worse? What are you doing to help with that?
Correct. So we kind of like look at the baseline of our patients and even men, if they're resulting to getting more detached from you, are they trying to overwork themselves, or how's their social functions with or social relationship? Are they doing some meaningful engagement with their friends and family, and how are they really performing in terms of the life work balance that they needed to be? Because as men, we tend to just show up every day and tough it out to serve as a role model. And as male providers too, we are actually the last one to seek help, right? We give all the best care for our patients, but at the end of the day, we are always the last one to seek help. And that's
Hmm.
problematic, because how can we deliver the best care for our patients when we are not full or our cup is empty?
I love it. So, Dr. Murray, when a clinician is a patient, is the treatment harder? Is it easier? Right? I try not to go in and identify as a nurse, right? But, when a clinician is a patient and you're assessing them for anxiety, depression, or other mental health disorders, what does that look like? Because, sometimes I say we know too much. And because we know too much, right? We don't go to the doctor as much, right? I know I don't. I try to self-medicate at home and I try to deal with it. I don't want to bother the doctor. So, what is that like from your perspective, being a provider, treating clinicians who may be suffering from something, depression, anxiety, any other mental health disorder?
So I have to get them to see you're the patient today. You're not the provider today. You're not the clinician
Yes.
today. It's your turn to be sitting on the other side, relaxing, and let's go through your process. Um, just learning how to breathe, telling them, hey, take time for you. And I always remind the clinicians when they come in, because I see a couple of clinicians, in order to take care of others, you first got to take care of you. And let's see what you're doing to take care of your own self physically, not only physically, mentally. Because like Brother Eric said earlier, a lot of times patients don't realize that mental health can affect things on the physical side, like your blood pressure, your sex drive, things like that. So I have to remind
Hmm.
them, like, you sit back, you relax, and let's go through some things. And what are you doing to better take care of yourself? Are you exercising? Are you eating right? If it's some things that you're not doing, what can we do to get that time in? If it's nothing but 5 minutes a day before you get your day started, let's meditate. Let's do some deep breathing exercises that you can do just walking to the shower, getting out of the shower. So things like that. But you have to, I think for clinicians, it's hard for us to sit down sometimes because we're so used to taking care of patients. And then sometimes we run into what we call compassion fatigue. And we
Mm.
gotta do things to take care of us, because once that compassion fatigue starts setting in, yeah, then that anxiety gonna start coming, then that depression. Not just in mental health, we see it even in primary care. If you think about it, providers are listening to problems all day. Whether it's my big toe hurt today, or whether it's me and my husband got into it today, and I don't know, this and this, or I'm just tired. My kids doing A, B, C, D, E, F, G. So they're taking in a lot of things. How are we de-escalating and how are we breathing it out? Are we spending time with family? Are you shutting the phone down? Hey, I'm not on call today. I don't need to check emails. I need to chill with my wife. Or I need to go see my son's baseball game today. What are you doing? And if I tell my patient, if I'm telling you that, what if I'm saying, hey, you need to be doing this, I need to be doing it too.
I love what you said when you talked about being on call, because a lot of us know that struggle of being on call. And we know that struggle all too well of being on call and having that phone at our hip, sleeping with us in the bed, waiting for that next call. And it leads to burnout, right? So, Eric, how are you treating burnout in the community? Because you do a lot of community nursing, but also as we talked about, right, you're treating providers as well. How are you helping people with burnout?
You know, just getting people to understand that that is a real problem, and I have suffered it with myself in the past, and I can see it on some of the providers when they come in. To the question you had earlier, and providers are high functioning professionals and used to being in control. It's hard to relinquish that control when they show up in the office. So you just have to get them to relax because, the pressure to perform, the pressure to deliver outcomes, the pressure to fix everybody else's problems, a lot of times we neglect ours and we don't realize we have a problem until somebody points it out. And being able to point that out to them and let them know, hey, this is a real issue for you. I'm seeing it and it's starting to show in other areas of your physical health. And then getting them to try to do some self inventory, understand how they might be processing this on a daily basis, especially what Dr. Murray said with the compassion fatigue that we're all are experiencing, especially now. Again, because we're having to see more patients to maintain the practice, and the Medicaid, Medicare, reimbursement rates are continuing to go lower, and it's so much stress at doing that, and a lot of times we carry that and we refuse to get the care that we need. And just getting them to identify that. And once you can get them to identify that, but I'm just going to tell you, the providers are hard to crack. They can be very hard to crack because, again, like you said earlier, we know too much. We already know the game you're trying to play on me. I already know the questions how you try to twist the questions to try to get that out of me, and they won't always answer and be forthcoming. So it is challenging. It is very challenging, but I have a way to kind of, again, put myself in the situation in the visit as well, and let them know that, hey, you're not by yourself, and they can relax. And once they see that, again, I'm just like them. A lot of times, man, they can just open up, and it's just it kind of it goes with the flow of the visit. And that's just some strategies that I've learned over the years that may not always be taught in school, but it's just the way I know how to. I never meet a stranger. I know how to talk to people, and that's just how I work it.
We're talking about the barriers to us getting care as males or as healthcare providers, and the good news about barriers is we can knock those things down. We can take that sledgehammer, we can knock it down. We know how to treat mental health. We know how to treat burnout. It just takes some great providers like the gentleman I'm on the call with to provide that education, to provide that knowledge to people. So I want to transition over to how do we treat mental health, right? What are we doing? What are you guys doing? What are the solutions and the pathways forward? And I want to talk to Dr. Morante because once again, I know you do all things, right? And I'm a fan of you teaching the next generation of providers to care for people with mental health disorders. So, Dr. Morante, what are you doing to help curve mental health and to actually treat mental health in our community?
Great. So what we do is like early detection of it. So we're looking at healthcare providers that are changing in their connection, like they're stop checking in, isolating, avoiding teamwork, or becoming unusually quiet, or there's a change in their language. They're more sarcastic, hopeless, or language towards their patient, then you can actually cut that early. Or change in recovery, they do not seem to reset after the time off. Every shift starts, they try to dread or have emotional numbness. So once we catch these early signs and symptoms, we kind of like walk through them, like give them an opportunity to talk about it and be empathetic too. Because they could be silently struggling, like they're facing some irritability, frequent absences, and that's something that we have to tell them that they need to balance things out and start seeking help or talking to a trusted person is really important. But what I see also in my practice is that if the provider is not a good fit for them, like they don't see the patient's cultural backgrounds, and also they don't connect well with their providers, then there's a seem like a disconnect. So we need to make sure we find that fit, and we ask our patients if their sessions are working well with their therapist or somebody that is working with them in terms of their medication. And a patient will be more compliant when they have this great connection with their treatment providers.
You brought up something that was actually on my little note right here. You talk about, cultural. And I'm gonna post this over to Dr. Murray, and I'm gonna, loop it back into your service connection. How important is it for that cultural reference or to be able to connect with your patient on a different level, right? How important is that, Dr. Murray?
I think it's very important, like Dr. Pedro said, absolutely. learning about others' culture. For example, I work with a lot of Native American patients. A lot of my patients, I'll say about 90% of my patients are Native American. I learn about their culture. When I go to conferences and they're talking about the Native American people, I want to be in on that. And also when I'm talking to my patients, I ask them, what is it that you want me to know about your culture? For example, a lot of my Native Americans, they don't trust Western medicine. And they go back to like they look at me like, you're a black man. I understand
Hmm.
the things you went through because they mistreated our people. The government did things to our people. They taken our land. And we talk about things like that. So just learning about that person's culture. And if it's something that I don't know, or if I feel uncomfortable with, I ask them, is it okay if I do this? You know, for example, a lot of Native Americans, they may come in the office, they don't show eye contact. Some people may look at it as disrespect. But in their culture, a lot of them don't show eye contact because it's how they were raised or how the white man made them feel inferior. So I have to look at that. Or if I come in and I shake their hand, I can't do a light shake. I need a strong grip so they can know, like, hey, you got a foundation, you got my back when I come to you with my problems. So, and we got to learn about culture and we got to be unbiased. And that, I don't care who you are, everybody has been judgmental. So every morning that I go in, I have to remember I'm seeing patients from all different backgrounds, drug addicts, people that have been molested, guys that have been molested as kids and now they're questioning their sexuality or they're scared to talk about it because, like, man, I know I like women, but this man touched me when I was a child. I'm scared if I say that to you, you're going to think I'm gay. So it's things like that. Like every say, we got to make sure that they feel comfortable with speaking to you. So just learning about others' culture, that's very, very important. And I'm like, Pedro, I'll tell my patients that, if you feel like I'm not a good fit, I got other coworkers. There's no disrespect. I have other coworkers. They may be a good fit. I want you to get the best care at the end of the day. That's the main thing.
I appreciate what you're saying, right? Getting the best care, that's the main thing. I want to caveat, or I want to talk about mental health in a different light because Eric, you do a lot of community health, and what I know as being a black male is that who I will talk to is my Barbara, but I won't talk to my doctor. So how do we get people from talking about their mental health with their barber, with their gym friend at church, and how do we get them to get to professionals who can, really make those appropriate recommendations? Because sometimes my barber give me some recommendations and they're not 100% above board, right? I know if I was talking to a clinician, it'd be a lot better. So Eric, what do you see in the community, and how do you get people to talk to people that they should be talking to?
There resources, letting them know what is in the community that they can plug into. Again, the shop talk, when you go in the barber shop, the barber, I actually think the barber should get some training in like counseling because
Yeah.
the patrons typically open up a lot when they sit in that chair. They share a lot about their life and the struggles that they have on a daily basis that they will never tell their medical provider. And I've done quite a few shop talk series here in the city of Houston and just making them comfortable with seeing a provider and be seeing me in that environment, and also knowing that I come in here too. And again, I got similar struggles, and letting them know, hey, these are resources in our community you're not aware of that you can tap into if you're struggling with depression, if you have PTSD, if any kind of abuse, whatever it might be. There is someone out there that can help you, and there are a lot of low cost to no cost resources in the community that you can also access, and letting them know that it's there because a lot of times it's not that there is how can I put it? It's not that there's not a lack of need. Again, the trust. And that's something that we know exists in our community for sure. And the cultural competency and that, not having a provider that you feel like you can really relate to, and you're not going to open up to them. So just, having that conversation and then bringing along sometimes I'm able to partner with some other organizations in the community that provide mental health services and psychological counseling. And they are able to share the resources and have brief talks with the people in that environment to let them know how to engage in those environments. Because a lot of times, because of stigma, we won't even go. And the cultural challenges that we have in our community as far as being judged for going. So it's a tough uphill battle, but we continue to fight that battle every day. And if we get one, we've done our job.
I appreciate you for sharing that. I think that it's important that we have these conversations and we be open and we be vulnerable. And I appreciate you, gentlemen, for really just taking time out of your day to chat with me about mental health because, frankly, we're not doing this. And I think that we need to. So, we've talked about the problem. We identified the barriers and then the solutions. So as I bring this to a close, I want to ask each one of you a pointed question. I'm gonna go back to you, Eric. In one line, what is the single thing you want every man listening to do tonight before they log off for their mental health?
Take a self inventory of the challenges that you're facing and be honest with yourself and have an open conversation about your mental health. And don't be afraid to find a safe space first. Find that safe space, and don't be afraid to share your innermost thoughts, because I would hate for you to be a statistic.
Dr. Murray, one thing you want, one thing you want a struggling clinician to know.
Learn how to breathe. And if we look at the word health, you take the word heal out of it. I want you to learn how to heal from the inside, and then we can work on the outside.
I love it. Dr. Morante, one change you want every healthcare leader to make.
I think one thing that every healthcare leader needs to make is the first one is to give us a platform or a space to talk about our mental health and do not use mental health as against us. So we have to leave it into the table and work with us, right? And normalize it. Have a check-in with us and have a honest conversation. And I think that's wherein the leaders and the members will collaborate and create a relationship wherein it's not like a one-sided format in terms of their mental health, but a collaboration joint that there's potential solutions to this. Men should not die in silence in terms of their mental health.
And for me, I want to leave everybody with this. No one is struggling with mental health alone. Asking for help is not a weakness. It is strength. It is the strongest thing you can do. Now, if you need any resources, 988, the Suicide and Crisis Line. It is free. It is confidential. They are 24/7. You can also call. You can text. You also have the National Alliance for Mental Health. That is a website that you can visit to learn more about different disorders. For clinicians, for us as providers, you can ask your employer about confidential EAP program, peer support programs. There are things out there that you can do. So I appreciate everyone for taking time out of your day. Dr. Eileen, I will turn it back over to you.
Thank you, DJ. That was a wonderful discussion, very insightful, very thoughtful. I hope everyone has something to take away from it and also will take something and share because I know everyone cannot make it, but I know somebody knows somebody that at least knows somebody that had some mental health, especially men. Men need a lot of support. It means a lot when somebody reaches out to a man and say, "Hey, what's on your mind? What's going on? I notice you are not acting the same." So please reach out to those men that you may notice are acting different or may go through different struggles because it's very important since us men like to be closed in. At this time, I just want to, open the floor for any questions or if you want to type something in the chat, go ahead and do it. So any questions or comments, general comments or anything you want to add to the conversation, feel free to unmute and do so at this time.
I'm on jump in here. Just kind of knowing all you fellas and the panelists. Personally, I want to say I truly enjoyed the conversation, and I think I've told this to a few people before. I never know. There's this thing where in my mind I imagine all these conversations are breadcrumbs to the future. And I just always get so inspired and hopeful that these discussions they'll get found by the future and they'll be like, man, they was having those type of conversations the same way we look at James Baldwin and some of the conversations they was having back then. And you go like, it's insane. So I just want to thank all of y'all for being a part of this because that's how I view it. I'm like, the kid in me is like, you know, or the future version of myself is like, man, these are the breadcrumbs that they left for us, and these are the breadcrumbs that we leave in, hopefully for who knows, man. So I thank y'all for being a part of this and y'all as individuals and professionals. So
Thank you, Mike. Any other comments or questions?
And can I say this right quick? I definitely want to go back to that 988 line. I have to stress this to patients all the time. Believe it or not, a lot of people think it's just you call in for suicide. So I have to stress the patients. They will talk to you about anything. I had a patient to call at 3 o'clock in the morning and said, Dr. Murray, I had a bad day. I needed someone to talk to. And he was like, man, that counselor just helped calm me down. So it's not only a suicide hotline. If you just had a bad day and you got financial problems, you trying to see, should I pay the water bill or the light bill? They'll walk you through the process. Never be ashamed to call. It's 24/7. They never close. Even on the holidays, they never close.
Yeah, thank you, Quentin. That's very important information because I wasn't even aware of that. So that's good to spread that information when you can. Yeah, so appreciate that. Anyone else? Any questions or comments? Anything like that?
If I may, I
Go ahead.
personally want to thank the panelists and Docs for having this conversation. This was very insightful and very well needed. As an educator, I'm in a BSN program or undergraduate studies. I spend a lot of time empowering my students, especially students of color, to speak of mental health, constantly asking them, are they okay? But really, do I ever reflect on my own well-being? So to have these type of insights as to what I'm not doing for myself to preserve my own well-being is very enlightening.
Thank you, Dr. Carton. Appreciate your comments. Appreciate your comments. Anyone else? Um, So just want to make note, we will be having some more webinars and with different topics. So stay tuned, pay attention to your emails, um, pay attention to the social media, because this is just the beginning. Myself and others, Michael, Dr. Blue, DJ, we have a plan to do a lot. So we're going to do a lot more. We're going to make impact in multiple areas, as I stated. So we recognize the importance of gathering as men in nursing and the impact we have. So this lot, stay tuned for that. Also, this one I have to, put a plug in for October 15th through the 18th, the conference, the annual conference. It will be in Detroit. So if you haven't signed up, sign up. It's gonna be something special. So I'm sorry you guys seen the social media. A lot of stuff. We're gonna have a Dimensions of Nursing panel discussing on prostate cancer. So there's gonna be clinical for the first time clinical tracks. It's going to be something new. It's always something new, always something special. So make sure you invite everyone. You don't have to be a DNP to go to attend. You don't have to be a DNP to be a member. You don't have to be a member to attend. This show up. You don't even have to be a nurse. We have non-nursing support as well. So tell everyone, spread the news. Hopefully, I get to see y'all in Detroit. Okay. So if that's it, I
but
appreciate everyone. I'll just ask the panel people to stand back while everyone leaves and closes out. Mhm. But thank you all for coming. I appreciate you guys.
Thank you, everybody.
Thank you.